Meeting the health needs of the poorest community in Africa, and in Cameroon in particular, is the main objective of Salvation Medi Rescue Mission for Africa, ESMA, a non-governmental organization. ESMA, through Dr. Simon Pechulano, a Cameroon medical doctor from the US of A, brought good tidings to the local population of the Douala 4 municipality on Sunday, 12th of January 2020, through the free screening of cervical cancer and other related diseases to more than 150 Douala city dwellers in Bonaberi.
Salvation Medi Rescue Mission for Africa, the mission is to meet the medical, spiritual, and other essential needs of the poorest of the poor in Africa, as the poorest communities in Africa. That's our mission.
It was a screening exercise which brought men and women from all walks of life, including those from the Baham community, from the West region, resident in the Littoral region, who believes health is wealth. Dr. Pechulano underscored that attending to the health need of this community to eradicate cervical cancer, which is the Millennium Development Goal of the World Health Organization in 2030, is his top priority, alongside other partners.
We're screening against cervical cancer. We're screening against breast, prostate, hepatitis, diabetes, hypertension. But our focus is cervical cancer because it is one of the diseases that not much is being talked about.
Reason why he is urging the communities to individually and collectively say no to cervical cancer, which is a silent killer, especially in sub-Saharan Africa.
Our partners are faith-based organizations, corporate organizations, men and women of goodwill. So we are virtually working with everybody, and that's perhaps what WHO is even encouraging. That this is not a disease. This is not a disease for the medical community. This is a very serious social menace, cervical cancer. So we're encouraging them, if they cannot do anything medically, they should create awareness. They should sensitize. So we're working with local communities. As we go in the next week, by this time, we will be in Galim.
Despite the limited resources, the lack of equipment and facilities, Dr. Simon, alongside his medical team in the field, were never discouraged, but on the contrary, strive harder to accomplish their mission.
The support is not there. Like we agreed, the community we're screening is a very big community. There are more than 5,000 in Douala City. We thought they would prepare us a very good place, but when we came, it was so difficult. This is what we could have, and instead of saying that we don't have space with this and that, complaining, there's no light, there's no socket for even our screen to show because normally when we screen, we have to connect our pictures on the screen. That's our TV. We connect, and then when we are screening, the patient sees all the images of the service. But we don't have that right now because we can't have it. There's no socket here.
Some of those who were diagnosed did not stay aloof. They applauded such initiative and encouraged others to get tested, know their status for early treatment.
I saw the breast cancer, I saw cervical cancer, and being a woman, those are the organs that makes you a woman. So I decided to check if I'm okay. But thanks be to God, my results were negative and I'm very happy.
Disseminating the information at individual levels to create awareness was their take-home message.
From my own self, as an example, I will alert my neighbors, my friends, my sisters, why not even the public as a whole. It is important to know your health state. You know, before sickness comes, at times, most often it's because we neglect certain things. I believe if we can find out and know before time, we will try to eradicate certain things, because when you come for the screening and there is any problem, I don't think that problem has reached a stage that has already developed. It's still trying to develop to get to a stage that will put you down. So the earlier you go for screening and you realize it earlier enough and they commence treatment, it will be far better for you.
Dr. Simon Pechulano has therefore given a clarion call to both the communities, stakeholders, the government of Cameroon, amongst others, to take action today and now and join the World Health Organization to stamp out cervical cancer by 2030. It should be noted that cervical cancer is a sexually transmissible disease caused by a human papilloma virus. It has no signs and symptoms, especially during its early stage. It is deadly, reason why early diagnosis and vaccination of young boys and girls is imperative.
We are at the Douala 4 municipality here at Bonaberi in the littoral region, where we have screened more than 200 women of cervical cancer, hepatitis, diabetes, and a lot more. The statistic this far, Dr. Simon says, is satisfactory. In the days ahead, we will be going to the West region to screen hepatitis, diabetes, and cervical cancer in 4 different villages. And this far, the results have been good. And so doctor is calling on faith-based organization, NGO, the government, you and I, in a nutshell, to join this effort and say no to cervical cancer, because the World Health Organization Millennium Development Goal for 2030 is to eradicate cervical cancer and making a thing of the past. This is Wamba Tangsi Mirabel, a freelance journalist working with Dr. Simon Pechulano of Salvation Medi Rescue Mission.